Hi, everybody. Stewart Gandolf here at the Patient Experience Summit with Cleveland Clinic. I have with me Dr. Paul Rosen, who is Clinical Director of Service Experience for Nemours. And we talked to Paul prior to the conference, and one of the things that really impressed me was first of all, his passion about patient experience with the families that he works with as well as the kids. He's a pediatric rheumatologist. And I also thought that was really great was his concept of not keeping patients and parents waiting unnecessarily. And there's a lot of other things. And this is a subject that's very passionate for Paul. So, Paul, I'll let you sort of share your story and why this matters to you and to patients and families.
Well, thank you very much, Stewart, and thanks for having me on the podcast. And I come from Nemours, so we are a pediatric system. And actually, our leader, our CEO, Dr. Dave Bailey, and the leadership team created our True North vision, which in the voice of the family is help me get the care I need and want, how and when I need and want it. And when we ask the families about that, it comes down to get me the care without delays. I want to come in to see the doctor before school, after school, weekends, not what we traditionally do. So we're trying to ask the voice of the family how we can improve our patient experience.
What I love about that is just the fact that it truly is patient-centric and patient-focused. One of the things we also talked about being that a lot of our subscribers are subscribing because they're interested in marketing. Tell me about some of the marketing advantages of putting the patient first and getting people in when they want to be seen.
Well, I think our culture at Nemours is to have the pulse on what the families are asking for us, and we have an extensive family advisory committee network, and we survey our families and ask about what they're looking for, and then we're engaging on what they want us to do for them, and at the same time we have a close relationship with the marketing team so that when we open up night hours and weekend hours, our marketing team helps communicate that message that we're available for families.
So one of the comments that you mentioned that parents oftentimes tell you, why did they choose you as a Nemours doctor versus some of the other great hospitals and institutions around?
Well, that's right. I mean, a lot of times I ask new patients, what brought you to Nemours? And they say, well, my pediatrician said I need to see a subspecialist. And we are in an area where we have multiple choices for families. And many times they'll say, well, we called around and you were able to see us quickly. You were able to see us tomorrow or this week, whereas other calls, they're told 3 weeks or longer.
So that actually reminds me, we shared this on the phone, that one of the people who work with me at our firm, son, they were worried he had lupus, pediatric lupus. And so it turned out in their case they were able to get in within a reasonable time. But you were telling me yesterday, when we spoke last, that sometimes because it's not medically urgent, this can be put off for a long time.
That's right. I think, if you're a parent and your pediatrician tells you, I want you to go see a subspecialist, right there, you want to get in as soon as possible to alleviate that worry. And maybe medically it's not urgent to be seen right away, but from a family emotional perspective, there is urgency, so you're not losing sleep at night.
And that's what I think is great about this whole summit. I mean, really what the whole summit is about, putting the patient needs to the top of the priority list. Rather than being a cog in a larger wheel and sort of fitting around at the convenience of the institution, the family is really the focal point.
I agree with you, Stewart. It's basically changing the paradigm, and all the speakers are touching on that how do we connect with families, engage them, and make it person-centered and not physician or hospital or system-centered.
Great. One last question, put you on the spot here. Give me an anecdote that you can think of where this really mattered to a family. There must be something where your extended hours, your availability, and how that impacted them when they came to see you.
Well, I hear from associates around our organization all the time how our journey towards True North has helped them help families. And I was talking to someone who schedules appointments a few weeks ago, and the scheduler was telling me how our ability to get them in quickly really impacted a father who was actually having cancer and had extra anxiety, and our ability to serve the family sooner made a huge difference for the family.
Absolutely. Great. Thank you so much for coming, Paul. It was terrific. I'm looking forward to getting to know you better and working with you again in the future. Thanks so much.
Thank you very much.
Thank you. Thanks, guys, for watching.